Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, one on one sessions, Q banks, question analysis sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. With all of my courses since 2015, I have maintained a 99% pass rate, and with my one on one sessions, I have maintained a 100% pass rate. Now, y'all know my disclaimer reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that I currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Now, I've received y'all's feedback from yesterday's video where there were some sound issues. Y'all stated that y'all were still able to hear it, so I'm happy about that. But just to update you guys, I'll be sure to reiterate those things throughout our diabetic series so that you're not feeling as though you're missing anything from that video, okay? But thank y'all for the feedback. But let's get into question number one. Question number one states, which of the following is a diagnostic criteria for type 2 diabetes? Is it a fasting plasma glucose greater than or equal to 100 milligrams per deciliter? B, a hemoglobin A1C greater than or equal to 5.5%? C, a oral glucose tolerance test greater than or equal to 200 milligrams per deciliter? Or D, a random plasma glucose greater than or equal to 126 milligrams per deciliter? Take a moment and tell me what you got in the comments, you guys. So y'all know I always recommend reading the stem of the question. Here, the stem is the question is the stem, right? But y'all know the stem of the question is typically that end of the question with the question mark, right? And I always say read that first because it allows you to slow down to ensure you're answering what's being asked of you. It's allowing you to focus in on what the question is truly trying to determine before you start to take in all of the fluff and things from the scenario. But here, our STEM is our question. Our question is our STEM. And it's just simply asking which of the following is a diagnostic criteria for type 2 diabetes. Remember that I told you guys that when we look at those diagnostic labs, we need two positive of the criteria to confirm our type 2 diabetes confirmation diagnostic, right? So our diagnosis, I should say. So I want you to be able to identify those labs and know them backwards and forwards. So you should be able to pinpoint what is a positive for a diagnostic criteria for type 2 diabetes. Now, is it a fasting plasma glucose greater than 100 milligrams per deciliter? No, remember with that, it is supposed to be a fasting plasma glucose greater than or equal to 126 milligrams per deciliter, right? A hemoglobin A1C would be greater than or equal to 6.5%. Oral glucose tolerance, C is your best answer because yes, greater than or equal to 200 milligrams per deciliter is a positive criteria. Random plasma glucose greater than or equal to 126 is not. Remember, with the random plasma glucose, it's greater than 200 milligrams per deciliter, right? Remember, I told you on yesterday to make sure that you're able to determine and not mixing words by rushing random versus fasting, right? So with the fasting, because you are supposed to be doing these labs on an empty stomach, if the fasting plasma glucose is greater than 126 milligrams per deciliter, that is a positive. Whereas at random, because you could have just eaten, you have a higher threshold, right? So then it is greater than or equal to 200 milligrams per deciliter. And then with the glucose tolerance test, it's also greater than 200 milligrams per deciliter. So here, the appropriate answer is C, because that's the only one that is the correct diagnostic criteria for type 2 diabetes, okay? Question number two, what is the target A1C level for most adults with type 2 diabetes according to the ADA? Is it A, less than 6.0%, B, less than 7.0%, C, less than 8.0%, or D, less than 9%? Take a moment and tell me what you got, you guys. All right, same scenario here. The STEM is the question is the STEM. And it states, what is the target A1C level for most adults with type 2 diabetes according to the American Diabetes Association? Now, I always like to ask y'all this question because I notice that y'all commonly miss this and mix these things up. So the best answer is B, less than 7.0%. Remember, this is somebody who has type 2 diabetes. For people who do not have diabetes, we want them less than that. We want them lower than that, but we want to maintain less than 6.5%, right? Because at 6.5% and greater, that's considered a positive for the diagnostic criteria for type 2 diabetes, right? So that 6.5 is that threshold for a diabetes diagnosis. But if they already have a diagnosis of diabetes, the target level is to be less than 7.0%. Okay. And then question number 3, what is the recommended frequency for monitoring the A1C levels in patients with stable type 2 diabetes? Is it A, every month, B, every 3 months, C, every 6 months, or D, every year annually? Take a moment and tell me what you got, y'all. All right, same thing for this one. The STEM is the question is the STEM. What is the recommended frequency for monitoring your A1C levels in patients with a stable type 2 diabetes? And remember, for this, the best answer is C, every 6 months. Pay attention to keywords stable. For someone who has stable A1C in our diabetic population, guidelines state to assess your A1C every 6 months. Now, somebody who may have an unstable A1C level, then you want to check it every 3 months to see the change, because you know what A1C is the average of those glucose readings over 90 days. So you would bring them back sooner if it was unstable. But for those people with stable A1C levels, you want to assess them every 6 months based on the American Diabetes Association guidelines. All right, you guys. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number 1 at gmail.com. Now, the things that I do offer are my review courses. If you're someone who prefer to study independently, I have a self-paced review for family and adult Gero reviewers preparing for both exams, the AAMP as well as ANCC. They're linked in the bio of this channel. I do offer my review book, which is an ebook option as well as paperback option. They're both linked in the bio of this channel. If you're looking to do any practice questions, my Cubake options are also linked in the bio of this channel. And then if you're looking to book any of my one-on-one sessions, I always say reach out to us, as I like to be sure that I know exactly what you're needing so that we can gauge and determine that you are booking the appropriate session to meet your learning needs so that we can take you to a successful board attempt. Okay. So again, feel free to reach out to us if you are looking for any of my review courses or options. But y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.